Hi, it's Nurse Camille with Nursing Survival. Find me at nursingsurvival.com for nursing-related study guides, as well as a guide that goes along with this podcast. I have fill-in-the-blank as well as coloring pages that help to keep you engaged while you're listening. Today's topic is cystic fibrosis. It is a condition that you will encounter in both the pediatric and adult settings. We normally think of it as a respiratory condition, but it affects more than just the lungs. Cystic fibrosis is an autosomal recessive genetic disorder that results in the body producing thick, sticky mucus. Usually mucus is thin and lubricating and allows for easy passage within the body. With cystic fibrosis, the thick mucus clogs ducts and passages, resulting in many complications. It can affect the lungs, pancreas, liver, intestines, and sex organs. Cystic fibrosis is an autosomal recessive genetic disorder that must be inherited from both parents. If only one parent is a carrier, then the resulting children may also be carriers. Cystic fibrosis affects chromosome 7, which encodes the cystic fibrosis transmembrane regulator. The CFTR gene is a protein that controls sodium and water transport in and out of cells. Mutation in this gene causes cystic fibrosis. Signs and symptoms of cystic fibrosis include excessive mucus that is thick and sticky. It can occur in the lungs as well as throughout the body. Coughing, wheezing, hemoptysis, which is coughing up blood. Hypoxia is lack of oxygen. Dyspnea on exertion is difficulty breathing with movement. Shortness of breath, snoring. Frequent respiratory infections, including lung, sinuses, and possible pneumonia. They often get antibiotic-resistant infections. Clubbing of the fingers or toes, which is a deformity in which the digits spread out and become rounded. Salty-tasting skin is a common characteristic seen on test. With cystic fibrosis, the body excretes too much salt through the skin. Poor growth and poor weight gain. Steatorrhea is excessive fat in stool. The patient may have frequent, bulky, foul-smelling stools and excessive flatulence. Constipation, inability to pass meconium, which is newborn stool. A meconium ileus occurs when the meconium blocks a part of the baby's small intestines in the ileum. The baby may experience bilious green vomit, abdominal distension, restlessness, and irritability. Meconium is usually passed within the first 24 hours after birth. Diagnosing cystic fibrosis is done in several ways. Genetic testing is done to detect the CFTR defect and can tell if a person carries the genetic traits. The sweat chloride test tests the sodium and chloride levels in sweat. A small section of skin is coated with a sweat-producing chemical, and then electrodes provide a mild electric current. The sweat is collected and analyzed. If the chloride level is greater than 60, it's positive. If the level is between 40 and 59, the test is inconclusive. Chloride less than 39 is negative. Prenatal screening is done with an amniocentesis. If both parents have the CFTR gene mutation, then testing may be done before the baby is born. An amniocentesis is usually done between 15 and 18 weeks of gestation. Newborn screening is done on all babies born in the U.S. shortly after they are born. A Hill stick is performed to collect the blood. A stool analysis may be performed as well. It can help determine if the pancreas is functioning properly and if the patient has other digestive issues. Cystic fibrosis causes many complications. The patient may develop diabetes. The pancreas is the organ that produces insulin. CF patients may have mucus blocking the pancreatic ducts, resulting in reduced production of insulin, as well as preventing the digestive enzymes from reaching the intestines. A pneumothorax may occur due to thick, sticky mucus in the lungs. Chronic pancreatitis is inflammation of the pancreas. Cirrhosis is scarring of the liver, again due to excessive mucus. Osteoporosis is often seen in late teens and young adults. This is due to difficulties absorbing vitamin D, which helps the body absorb calcium. Poor nutrition, chronic infections, and diabetes can also contribute to it. Infertility can affect both men and women, but it is seen more in men. This is because men are born without the vas deferens. Esophageal varices are abnormal enlargements of the veins in the esophagus. Patients with CF normally develop it due to liver issues such as cirrhosis. Esophageal varices can be life-threatening. Rectal polyps are abnormal growths in the lining of the rectum. Constipation may occur. The patient may also experience hyponatremia. This is when the body loses sodium through sweat. It can result in dehydration, tachycardia, fatigue, weakness, and a decreased blood pressure. Hyponatremia is a sodium level less than 135. The patient may have frequent infections including sinusitis, bronchitis, pneumonias, pseudomonas, and aspergillus, which is a fungal infection. Often the patient develops antibiotic-resistant infections. Gallstones. Heart failure may result from pulmonary hypertension. Thickened pancreatic secretions can cause malabsorption, poor growth, difficulty absorbing fat-soluble vitamins A, D, E, and K, constipation, and intestinal blockages. The patient may also have bleeding disorders. There is no cure for cystic fibrosis. However, there are many treatments for controlling symptoms and lessening the impact of the illness on the body. Antibiotic therapy may be needed during periods of illness and infection. They frequently acquire antibiotic-resistant infections. A lung transplant is a treatment that replaces the unhealthy lung with a healthy donor lung. It carries additional risk, and the patient will have to remain on immune suppressant medications for the rest of their lives. The patient will no longer have cystic fibrosis in their lungs, but will still have it elsewhere in the body. Chest physiotherapy is percussion or clapping on the patient's back to help break up mucus. Positive expiratory pressure, PEP, helps produce resistance when breathing out. This helps move the mucus. There are several types of medication treatments that your patient may be on. Pancreatic enzymes help digest carbohydrates, proteins, and fats, as well as help absorb nutrients. Anti-inflammatories such as corticosteroids and NSAIDs help reduce inflammation in the body. Mucolytics thin the mucus in the lungs. This allows the patient to be able to cough up secretions easier. Bronchodilators such as albuterol help open up the airway. Hypertonic saline is inhaled with a nebulizer. It has a higher concentration of salt than the blood. This helps thin the mucus and aids in airway clearance. Antibiotics are used to treat lung infections. Nursing considerations and patient education for taking care of patients with CF include providing emotional support to both the patient and the family. The patient spends a lot of time in hospitals. This puts a lot of strain on them and their family. The patient can be lonely. They may also develop manipulating behaviors to get attention. There is no known cure. Patients are diagnosed early and have complications or illnesses from almost day one. The goal while caring for cystic fibrosis patients include infection prevention, maximizing organ function, limiting damage, and adequate nutrition. The patient may need chest physiotherapy, which is percussion or clapping over the chest and back to help break up mucus. Positive expiratory pressure, PEP, may also be needed. This creates resistance when breathing out to help move mucus. You may need to demonstrate pursed lip breathing. It can help improve shortness of breath by slowing the respiratory rate and keeping the airways open longer. The patient inhales through their nose and exhales through tightly pressed lips. Encourage the use of the incentive spirometer as well as coughing and deep breathing. They may need to be in semi-fowlish position to promote lung expansion and decrease airway collapse, dyspnea, and work of breathing. They may also need to be positioned with their head downward to help with drainage. Assessments for your patients include the respiratory rate, rhythm, auscultating the lungs. The patient may also require oxygen therapy. The normal goal is greater than 90%. They may require frequent oral care and suctioning. The patient may need to be on isolation precautions due to a compromised immunity. They may have also acquired infections such as MRSA and VRE. Visitors may need to be restricted. This can also lead to further isolations and feelings of loneliness. Encourage the patient to get their regular vaccinations. The patient may also need to be educated and encouraged to exercise, as well as perform activities of daily living for themselves. Keep in mind, though, they may need to conserve their energy, especially during times of illness. Nutrition is very important for patients with CF. The patient may need to take pancreatic enzymes with each meal, encourage small, frequent meals, and resting. They may need a high-protein, high-calorie diet and to increase their sodium intake. Vitamins and supplements may also be needed. Educate the patient as well as assess for signs of infection. This includes a new or worsening cough, increased sputum, fatigue, and an increased oxygen requirement. Thank you for listening to this episode of Nursing Survival. Find me at nursingsurvival.com for more study guides. I'd love to hear from you. Send me any topics you'd like to hear. More study guides will be coming out weekly, so join my email list. I will also have special promotions and giveaways. Thank you.